On my screen, it says the host has asked you to start your video. That's just there from earlier, right?
Thank you for joining us today. We'll be starting the webinar at 12 o'clock sharp. Thanks for joining us. We'll be starting in 1 minute.
Welcome everyone to the Bend Chamber of Commerce COVID-19 Impact webinar for this week. Really appreciate your time, and I am grateful to be sitting in front of all of you folks, hopefully sharing some information that you'll find useful with your businesses. Before we get started, I've got a bunch of things to chat with you about, but I want to start off by thanking Pacific Power for helping us put these on every week. And sponsoring the webinars and bringing assistance and information to our businesses in the region. As we begin today's topic on the impacts to businesses and their employees and looking at it from that angle, I wanted to share tidbits of information that I've garnered just this morning to share with you. Some of this might not be news to you, some of it might be, so I'm just going to go ahead and share it. For those of you who haven't heard, the PPP and the EIDL loans are now closed. They have maximized the number of intakes and also spent all the money. There's a lot of discussion going on in Washington, D.C. right now about extending that, adding more money. So stand by, hang in there on that. Give you a little idea of what Oregon has garnered from the first round of these two loans. We have issued, or SBA has issued $2.4 billion to the state of Oregon, and that equates to 9,508 loans for Oregon. We're in the middle-ish of the pack in the US as far as how much money and how many loans we've issued. Also, I wanted to mention that if you're waiting to hear, you should have heard from your bank for the PPP loans that you're in process, or been assigned a number from the SBA for the EIDL loans. So if you have any questions on that, there should be information on your bank or the SBA website. So one of the things that you can be doing if you are a business owner, I'm going to get into more details at the end of the webinar, but I encourage you all as business owners to go to the sosbend.com website. They are uploading businesses right now. There's a process you can go through to get your business registered, to connect you directly with customers throughout the region and elsewhere to help offset cash needs in the short term. And we're uploading businesses right now. We've onboarded about 130 so far in the last day or so. And we've had over 1,200 clicks. So really encourage you to go there as a funding source to shore things up. So I just want to say outright and acknowledge how hard this is for all of us and for those of you who are employers and employees. There's just no other way to say how sorry we are about the impact that is happening out there. And anything that we can do to assist and provide information and some predictability in this strange world, the Ben Chamber and those of us in economic development and government are willing to help. So one of the things the Bend Chamber is doing is pushing the state and the city of Bend right now to really get going on allowing us to weigh in on and understand what the rollout of reopening business will look like. What's the criteria? What are the metrics that we're measuring against with public health and safety? And what does it actually look like on the ground for those of us with restaurants, with dental offices, with whatever it is that we do, so we have time to prepare. So I know that the city and city council last night is moving forward with putting some protocol together. I understand in the next few weeks that the state of Oregon will be working on their Reopen Oregon plan, and we'll be hearing a lot more about those two things very shortly. So I'd like to start today's webinar also with sharing a few of the unemployment numbers that I just received from Damon Runberg, our state economist, this morning. So Deschutes County has had over 10,000 unemployment claims processed. They believe this is about 50% of what actually has been in the system. So they're expecting about 20,000 people have filed in Deschutes County for unemployment. That's an 8% unemployment overall for Deschutes County. And more than 50% of that are people between the ages of 25 and 44. So these are folks that are working in the high impact lodging, and also retail, restaurants and food industry, that sort of thing. So that's what it's looking like right now. Oh, here it is. 20% is of that layoff is in accommodation and food service. So that's what the picture is that we're all looking at as we begin today's discussion. We have a number of folks that we have lined up to talk with you today and take your questions at the end. So we're going to speak to owners and directors of very different local businesses today about what's happened with their workforce over the last few weeks. We'll have people from Cheri from Zydeco up, Pure Care Dental, the Boys and Girls Club, just sharing what will be familiar to a lot of you folks of what it looks like on the ground. Our hope is that hearing from them will help you learn from what they're doing and be able to ask questions and inform the conversation. We'll also understand what's available to employers and employees as a part of the WorkSource program. And finally, we'll get to hear some important things from a legal standpoint of what does it look like when you reduce your workforce, and what are some pointers from the legal standpoint of how you're handling it, and hopefully one day how do you bring people back on. So little housekeeping. If you have questions, when you go to the bottom of the Zoom screen, you probably are all familiar with this at this point, there's a Q&A button. That's where you submit your questions rather than the chat button. That way I can see the feed as we go. We usually get way more questions than these and I can get to, and I apologize to you ahead of time for that. I'm going to do my best to aggregate those questions and get as many out to our participants as possible. So with that, you will be seeing some slides as well, and we'll have some support materials. Know that we will share that. All of this will be on YouTube and our website when we're done, so use it at will. And what I'd like to do now is introduce our first guest, Cheri Helt from Zydeco and Bistro 28. And she's also happens to be our state representative from House District 54, working hard for us. And we've asked her to come on board and first put her restaurant owner hat on and share her experience with us. Cheri?
Thanks, Katie. Thanks to everyone at the Chamber for all you're doing. It's really helpful for all of us businesses to be able to have a resource, and you're just doing such a great job at, running fast and getting the information out as fast as you can. This crisis has been really hard on all of us, and my heart goes out to everybody that is on this Zoom call. I know that you all are business owners and employers and employees, and this has been tough on everyone as we navigate through these uncharted waters. I would have thought that going through the recession just a little over 10 years ago would have helped me and my husband as business owners be able to navigate through this crisis. It really hasn't, because this isn't anything like the recession. As business owners, we've always tried to save enough money to make sure that we would be able to make it through an economic downturn. But this is more of a shut off. It feels more like you took a water faucet and you just shut it off. But what we had prepared for was a decline to 20 to 40% of our sales, where in actuality, where we're at today is we're down 90% of our sales. So surviving on 10% of income while trying to take care of your employees, make sure they have benefits, make sure they can pay their rent and get food through the crisis, has been an overwhelming burden. And I know that all of you are feeling that as well. So I know that we're all in this together. The one thing that I would say about this is first and foremost a health crisis, and we're in this to save lives. And all of you on this call have, done Herculean efforts to save your businesses, save your employees, as well as saving your neighbors' lives. And so staying home and staying safe is a real sacrifice for people, and you are really doing that. And I'm proud of our community for that. But as we've traveled through this, my husband and I tried to figure out, okay, what does this mean for us? We first had to go through the governmental regulations that were put forward and figure out what that meant. For us, social distancing is a little interesting because we have cooks that normally work over the top of each other, and they finish each other's plates, and so we put tape down on the floor to make sure that we could have social distancing and make sure that we were doing it in within the confines of the law. So our kitchen looks like a basketball court right now with taped lines everywhere to make sure everyone stays in their spaces. We have new protocols where we put in place to use bleach water or peroxide cleaner, because sometimes the peroxide cleaner is not available because it's been in such demand. So we bleach or peroxide all of the countertops and everything every hour to make sure that we're keeping the highest of sanitary environments to be able to cook our food and get food out. We did make the choice to stay open as a to-go restaurant, which really was not our big thing. We don't do a lot of to-go sales, as you would think, at Zydeco. Bistro 28 was not able to stay open due to the social distancing and the layout of the kitchen. There just wasn't enough space in the cooks areas to be able to allow them to safely not touch and cross each other's paths. So what we did was close that one completely. The loft, obviously, we can't keep open, so that was closed as well. So we have 2 closed, 1 open with 10% sales, and then just trying to make sure that we could take care of our staff as much as possible, keep as many people as we could employed. We've went from 104 employees to 15 today. And so we reached out to all the programs that were accessible. I also tried to get all these programs and get on as many Zoom conference calls and get out the information to other business owners, because I think that the biggest thing we can do is keep Central Oregon to look the way Central Oregon looked like before this crisis started. So when we dust off our doors, that we all dust them off together. So I was trying to do my work and homework and also get it out to all of you so that you can use these programs as well. I'm hopeful that a lot of you on this call are some of the recipients of the PPP program. My husband and I have received a PPP loan, and now we're working through the steps of how that looks. And I gotta be honest with you, it's a little difficult. You have 8 weeks to spend it, and the regulations aren't really laid out very well. So it's like trying to do the math and figure out if we meet all the criteria while trying to figure out who we can hire back and how we hire them back. One of the problems for us is, how do you hire people back if some people are working and you're not going to have an actual job for other people? What does that look like? I think that's going to at least take us a week to figure out how we're going to implement those types of things. So we're just grateful that we're able to have that and keep working towards trying to find the perfect solution to keep everyone employed. And so that's really the goals, is to keep our employees whole, keep their healthcare benefits while we're in place with this downturn, because I don't want anyone to lose healthcare. And during a pandemic, it seems really counterintuitive, as well as helping my employees get unemployment benefits while we're waiting for the PPP loans, see who can come back to get on the PPP loans with us. One of the things that's difficult is a lot of people haven't gotten their unemployment yet, and they're scared to get off of their unemployment before they receive it, because they'll be getting back pay. And so that's one of the challenges that we've found. And I think the resources that I found helpful are having the chamber and reaching out to other businesses, and just the level of collaboration that we have in Central Oregon is unprecedented. And I think that helps all of us, that we all are in this community and we're in it together. And I very much feel that way as a business owner. And so I'm proud to be able to listen to and share my stories with other people. And then our future plans are just to stay in business, really. I mean, just to hang on through this and keep looking towards what the reopening looks like. How do we do that? I have some concerns around that because I know there's going to be some limits on how many customers we can bring in. I'm a little worried that that will be very difficult to sustain from an economic level as a restaurant. We may have to continue to go instead of opening up if the guidelines are too small, because the staff ratio, if we have 25 customers that we're allowed to serve, well, we have to have 15 staff to do it. Those numbers won't work. And so we'll just kind of have to keep, figuring out what it looks like as we keep plugging along.
Great, thanks, Cheri. And just a reminder to everybody that there are restaurants out there still doing takeout. I have Zydeco myself and had some yummy dinners at home from Cheri's restaurant. So
thank you, Katie.
Please do that. Yeah, and just one last thing too is, when you actually do look at a reopening, as the governor starts to roll out the Reopen Oregon plan, have you already started to think about what that looks like for your restaurant?
Yeah, we're just looking at, if the guidelines are, size of the dining room and how many people can come in, at what level can we sustain the labor and the food cost to be able to reopen. And so we'll have to determine when. We may not open for the first wave, depending on if we can meet that from a budgetary standpoint. So we may just keep doing to go until then. And also it's going to mean, we're going to have to look at what do people feel like? When are people comfortable? I think one of the hardest parts about restaurants reopening is it's a group. You're in with a lot of people. And so when are people going to feel comfortable that they are able to go back out and eat? At the beginning, will people be comfortable to go back out and eat, or would they rather get to go and still be in their homes and maybe doing just a few more different types of economic things that they would not have been able to do during the shutdown?
Yeah. Thanks, Cheri.
Thanks, Katie.
You bet. So next we're going to go to Brianna Caldwell. She is from Pure Care Dental, and she's going to share a little bit of what the situation is for the dental world and the healthcare world out there. Brianna?
Thank you so much. Thanks for having me. I know that this has been a challenge for most industries in the area. Dentistry, definitely a huge one. So we've seen, same with Cheri and Zydeco, we've seen about a 90% drop in revenue in time. We, as a dental field, are only allowed to see emergency care patients at this time, meaning that we laid off all of our hygiene staff, one assistant, and then are attempting to keep the rest of our staff employed on some level. So one of the first things that we did as everything was kind of rolling out is ensuring that all of our sanitary protocols at the office were either at or above what the CDC was recommending. We just wanted to make sure that, okay, are they saying we should do something in addition to what we've already been doing? And thankfully, we were kind of doing everything the CDC was recommending. So that kind of made us feel good. From sanitizing, we've changed a few things, such as taking temperatures of staff when they arrive, taking temperatures of patients when they arrive, having patients wait in their cars before their appointments. And so then we'll either call them or physically just kind of give them a wave to come on in. That way we're ensuring that not many patients are spending really any time in our front office lobby. So kind of further ensuring the social distancing aspect of things. Keeping an eye on anything that a patient or staff member touches throughout their visit or throughout their workday, properly sanitizing essentially everything that somebody touches, from a pen to a credit card, payment machine, everything gets wiped down in between touches. We are continuing to see emergency patients, and this we feel is really, really important to do. We are a healthcare provider, and so trying to keep patients out of the emergency room is a huge thing. And a lot of patients in times like this go to the emergency room when they're in extreme dental pain, and we're trying to help ease the burden on our emergency workers. We thought initially that we could try to keep all of our staff employed at 75% of their hourly, and that became very apparent within 24 to 48 hours that that was not going to be an option. So we, again, laid off hygiene, one assistant, so that's a quarter or a third of our staff. Really hard decision to make, but we have promised all of our staff members, including the ones that we have temporarily laid off, because we will have a position for them when all this is over, that we will continue paying for their health insurance in full during this time. We don't want any of our staff members having to worry about that. They're already worried about so many other things. I also applied for the WorkShare program to help out with our staff that were still working. Initially, WorkShare on their website and in paperwork said, well, this program is if you cut hours by 20 to 40%. And so we thought we would be able to do that. Turns out that our hours have been cut more than that. I cannot find now any paperwork that encourages that limit. So hopefully they have kind of changed their viewpoint on that, trying to reach out to WorkShare via email and phone call is, like everybody's experienced, impossible. So I'm trying to lead my staff in a direction that I don't even know is the right way to go. There's been a lot of uncertainty, but let's see. We did get approval from WorkShare. I got an email about that, but no further communication, no money has been received by my staff with regards to that program. So hopefully soon. We've been communicating with patients directly via phone calls to all patients who were on the schedule through June 15th, because that's when the governor has said that we're not allowed to see patients. And so all those patients are getting a personal touch from us, continuing our normal quality of care, and that personal touch is really important, as well as sending newsletters out. We donated our extra PPE. So different than PPP, the PPE is the personal protective equipment. So we donated what we had that was extra at our office to the St. Charles Drop-Off Center. We felt like that was also trying to contribute to the overall good of our community. I, as a business owner, have tried reaching out to different areas where our money goes out the door, trying to figure out are different companies making sacrifices themselves on behalf of their customer base. So for example, Aflac, our Aflac rep said that Aflac is not going to be deducting for the month of April or May right now. It might go further. So that was a huge burden lifted off of my staff members. In terms of where's that money going to come from. Our scheduling software company has said that they'll reduce our rates by 50%. Our radio and television advertising reps have been phenomenal in trying to work with us. I know that they're hurting really bad right now, but everybody's just doing what they can do. Let's see, we tried to reach out to the owner of our building that our office is in, and that was not helpful, but you know, we'll see what the future holds with regards to that. We do a membership program at our office for patients who don't have dental insurance. It does have like a monthly due program. We have paused that entire program for all of our membership patients, and that's about 50% of our patient base. So we're not drafting dues for the months of April or May, and likely June. We don't know right now, but that has cut our revenue at our office, our monthly revenue, by about 15 to 20%, in addition to limiting patient care, but we just felt like that was right as a business. But we are also promising those membership patients that even though we've paused their membership dues, that we are still promising that we will see them if they have an emergency, and that they will not be charged for the emergency exam and x-ray portion of the appointment. And so just trying to do our part to care for people. We set up teledentistry services so we can speak to people either via video chat or phone call to ensure that what they're experiencing is a true dental emergency before they come in. So again, it's limiting numbers of people. We applied for the EIDL and the PPP. I reached out to the SBA yesterday because our EIDL hasn't gone through, and I applied on March 31st. They told me on the phone that it's a 3-week turnaround time right now before one of their reps will reach out to a business. So just in case anybody hasn't heard anything about that, 3 weeks. So for me, it's next Tuesday that I'll be making a phone call if I haven't heard from them. Our PPP loan has been approved, and it was funded yesterday evening. So that's good. Now we have some decisions to make about staffing, and do we bring everybody on full time and not have anything for them to do, or kind of what does that mean? We also communicated with Volunteers in Medicine. We see patients through that organization free of charge to provide emergency dental care. Usually we see 2 to 4 patients a month with them. We have let them know, hey, if you have 8 in a month, we will see them. We want to take care of your people. Things that helped. We have a phenomenal staff, a wonderful team that have been so understanding and grace-filled with us not knowing the right way to go and not knowing the answers. That's made a huge difference. It has further solidified how we feel about how awesome and incredible our team is. We check in, I've been checking with them regularly to see how we can support them and their families, which is really important because it might not even be monetary. It might not be the money thing. It might be something else. We have one staff member that has an 18-month-old that's crazy busy, and what do you do with that? So trying to provide hand-me-downs from my kids' stuff to her to try to keep her little one busy. I've been doing a lot of webinars, both from the chamber, various industry leaders, ones that have been, they've all had a little tidbit of good information, but some of them that have been really great have been ones directly from the dentistry industry, because it is kind of a specific field. I've reached out by email and phone to people who I considered experts in business. COCC, the Small Business Development Center. Thank you so much, Ken, if you are listening. You are awesome. I reached out to the COCC Small Business Development Center to ask some questions. They called back and spoke with me personally within 24 hours. Phenomenal job, and such a resource that our community has. If you have questions about anything about what to do, give them a call, and it's free. It's awesome. I've reached out to other business owners to see how they're handling things, other dental classmates of our 2 dentists to find out what their offices are doing. Things that didn't help, trying to get answers from government-related sectors like unemployment and WorkShare. Doesn't matter how many hundreds of times a day you can call or email. They're just inundated and overloaded. That's just the fact. Another thing that I felt didn't help is maybe it's my own criticism of myself, but ripping off the Band-Aid too slowly with regards to furloughing my staff members and cutting hours, because then that just put them further in the queue of filing for unemployment. Yes.
Brianna?
Yeah, sorry.
I'm sorry. I'm going to have to move on to the next speaker.
That's fine.
Really great information. I so appreciate it. But I want to make sure we have time for questions at the end.
Yep.
So thank you so much for that. Next up is Juliana Williams. She's with the Boys and Girls Club, and a totally different perspective of, again, working with little people, a lot of folks, and what is it like during this crisis, and what things have you employed as far as helping your employees and moving forward? Go ahead, Juliana.
Thank you so much, Katie, for having me. Yeah, it's really interesting. You know, we're an employer and we have to operate like a business, but we are mission driven and we're a nonprofit. And so there is a different lens through which we look as an employer. So I started with the organization in this role last May, and things, the beginning of this year, were starting to look really good. I imagine a lot of business owners or different directors were feeling that way at the beginning of January. And then boom, COVID hit and everything changed. And I think we're all facing really gut-wrenching decisions. They're kind of all bad decisions, and we're just trying to make the least worst decision, you know, at the moment. And so for our organization initially, when things were starting to unfold, you know, we're very tied to the school district. And so when the school district was talking about temporarily closing, you know, in March, we were trying to think about how we could pick up the slack. You know, can we step in and can we offer full day programming? Can we extend our spring break? How do we do this? And it became clear within a week that wasn't going to be manageable. And then the guidelines came out really restricting the number of kids you can serve to 10. And a lot of restrictions that just weren't sustainable for us as an organization. And so, yeah, it felt incredibly strange as a mission-driven organization to say we have to stop what we're doing because we're service-based. You know, we don't have a product that we can continue to deliver. And so we have to stop our in-person service. And so pivoting to, you know, what can we provide in terms of access to food and other resources for our families during the closure period. And you know, then it quickly became, well, what about the finances of this? If we're closed, we're not taking in any program revenue, donations. We were projecting to be significantly down, which they have been. and we need to go based off of essentially zero cash flow projections. And our board is incredible. They were very, very involved from the beginning and was able to just, really work through a plan of what was this going to look like. And it's incredibly difficult because, as an individual, I love my team. They're my family. And I think as business owners, Cheri spoke to it, we care so much about the people that we're working with and we want to take care of them. But it felt fairly certain from the beginning that this wasn't going to be over and done with in a couple of weeks. We were looking at the long haul and we needed to prepare for that. And so
Juliana, I think we're losing you. I'm going to go ahead and take over here because I think we lost Juliana's bandwidth there. So I'm going to go ahead and move on, and Juliana will come back to you if we get you back on. So next up is Dana Dunlap, and she's a program manager at COIC and WorkSource. She's going to share a bit of information with us about what services they can offer to help you deal with your employee situations in a proactive and hopefully compassionate manner. Go ahead, Dana.
Hi, good afternoon. I think first I just want to share with you what we do at WorkSource, what WorkSource is, and then do my best to provide some help to those businesses out there. WorkSource, honestly, we're a brand. WorkSource is a brand, and if you think about an umbrella with collaborative partnerships underneath it, that's what WorkSource is. So we are in partnership with Oregon Employment Department, Department of Human Services, Commission for the Blind, Vocational Rehabilitation, Central Oregon Community College, the Title IB WIOA, which is the Workforce Innovation Opportunity Act contractor, which is through COIC, who I work with. Many of our partners are co-located in the center. If not co-located, we have visibility in all of our centers. What I want you to think of in WorkSource is a place that has a variety of resources available to specifically related to employment for both employers and job seekers. We make connections for people. We connect job seekers to employers, and we also help recruit and manage listings for employers. We used to offer in-person workshops. We have taken those virtually now. So we've got workshops for resume, interview preparation, soft skills, and networking, and we're looking to expand on these in the near future. We also have dedicated staff who are taking quite a few phone calls right now, but we do have some dedicated staff through COIC that are meeting people one-on-one to provide resume coaching tips and help prepare applications and even doing mock interviews. Some services also to keep kind of in the back of your mind for some of your employees is that we do have scholarship opportunities for them to pursue some education or short-term training. And then we also have an awesome program called On the Job Training for employers. It's an incentive for employers to hire and train candidates that don't necessarily have the technical skills, but they have the aptitude and may present as being a good fit for the company. I understand that may not be something you think of doing right now. However, in the future, when you're starting to rehire your workforce, if some of your employees have moved on to other opportunities, this might be a great program to resource. So again, we'll pay up to 50% of those training wages. The training period looks like about 2 to 4 months. And we work directly with the training manager or supervisor to create a plan and design work objectives for the employee during the course of that OJT. Some examples I'd give you would be a medical assistant that graduated from college but didn't have any hands-on experience, or a software developer that is transitioning to another company that does not have specific code, and even clerical and receptionist positions as well. So we also have a business team, a dedicated business services team that work with our local employers and provide assistance in recruiting qualified candidates, including pre-screenings. And then we also, those same individuals will work with individuals who are looking for work and actually reach out to companies who they feel would be a good addition to their team, or connect them with open listings. All of our services are free to both employers and job seekers. And right now, just because of everything happening with COVID-19, we are not able to provide services in person, but we are providing services via phone, Skype, email, etc. So one of my roles as program manager for WorkSource is being a rapid response coordinator. Now, I understand that saying rapid response and dealing with the unprecedented time that we're in right now, those two don't really go hand in hand as far as a rapid response. So know that I am sensitive to that. And I am, myself and my team have reached out to hundreds of local businesses since March 16th. And we have really been trying to connect with you to provide informational videos, documents related to dislocated worker guides, to health insurance, and healthcare marketplace. So we're really trying to get as much information out to our employers as possible that you can share with your staff as far as how to navigate unemployment. How to navigate unemployment is different now with COVID-19 than it is for traditional unemployment. So what I highly recommend is before anybody applies for unemployment is to watch the videos and the FAQs that are listed on the unemployment's website, which I've added in this slide at the end, which you guys will get a copy of. I think it's really important that everyone looks at that first before applying, because if they mess up on one question, it could delay their application. And we also do virtual meetings for employers with their employees if they are still employed to really talk to them and help them with understanding those resources available at WorkSource. Another program, which Brianna, I am so sorry to hear that this situation with WorkShare is not working at this time. So I found out earlier this morning that there is quite the backlog, just as there is with unemployment, on the WorkShare program. And if this is something that you're considering that you can, put into play maybe in a couple of weeks, then apply for it now. They are working as hard as they can, as best as they can, to get through all the applications. And I understand how hard it is. I sympathize with you. I feel for you. I've been a business owner and lost my business in the last recession. So know that we care, we hear you, we hear your frustrations, and we want to do everything we can to help you. So hopefully in the future we can work with the chamber and have some of the representatives from the employment department potentially bring you some updates. So thank you, Katie, back to you.
Thanks, Dana. And thanks for all you're doing to help us all out. We appreciate that. And we can certainly talk about what it looks like to ramp back up to whatever the new normal is as we transition out of the stay-at-home mandate. So thanks for sharing. Next up, a little legal advice from our friend, Kurt Barker. Kurt is a partner at Karnopp Petersen and has a bunch of information to share with us today. And we've asked him just to come on and share some of the highlights of some pretty frequent questions we've been hearing from our members. So Kurt, I'll hand it over to you.
Katie, thank you. Thank you for having me. Because I'm going to dive into the tactical and technical pretty fast here, I did want to start out with just a reminder or maybe an update of where we are at Karnopp Petersen. We have 35 some odd bodies between lawyers and staff. And I think on behalf of everybody, we feel incredibly lucky to be able to help our clients. Right now, we're able to work remotely, and feeling incredibly fortunate for that. We've been able to serve folks that are at 100% right now. It has dramatically changed the face of what our clients need right now. I think the last 3 weeks, the first 3 weeks of the crisis, I did pretty much nothing but mass layoffs and terminations. It's been one of the worst times of my career that way in terms of just the type of requests that we're getting. As an aside too, the estate planning lawyers are even busy because they have an unprecedented amount of panic about I could pass away any day. So we're thankful we can be there. For you, but our hearts go out to each and every one of you who've been hit so much by this. We can't wait to be able to get back together. I know nothing livens up a lunch hour like legal review and a PowerPoint. So we're going to go through a whirlwind tour of legal considerations for layoffs. One theme that I'm going to have for you is about the broad discretion you do get when you have to reduce hours, reduce pay, furlough, layoff. Employers get broad discretion as long as they're relying on legitimate business reasons. You might have more options than you think. So there's lots of flexibility here for you. Now, as an outer limit, for any time we're going to do something that's adverse to your employee that could hurt them, we want to think about, do we have contract rights in play? Is there a union agreement? Most of you don't have that. Are you government? Most of the people on this call are not. There'll be special rules there. Certainly if you have individual employment contracts too, you'll want to review those. But what is near and dear to my heart or concern or worry list, anytime we're making these decisions, really comes down to protected classes and protected activities. We can't base our decisions on those factors. So what are we talking about? Protected classes is something about a person, their race, their age, their national origin, sexual orientation, you name it, the list goes on. I've attached my greatest hits list at the end of the slides that you'll get, but I've given you a link as well to a longer list from the Bureau of Labor and Industries, or BOLI. Protected activities, what are those? Reporting financial fraud, complaining about unlawful workplace harassment, asking about protected medical leave. That's a huge list too. Same thing, you've got some samples to look at. What we're worried about here is if you're deciding to pick and choose between your workers, say based on performance, you can do that. You can choose people for layoff or furlough based on their performance, but we want to make sure that, number one, classes and activities, protected classes activities, don't come into play, and it doesn't even have that appearance of having come into play. Now, those primary risk factors, protected classes, protected activities, those are the issues that generate the bulk of employment litigation, period, stop. But most of those concerns really do fade back if you are doing, say, a department by department furlough or layoff, if you're laying off everyone with a particular job title or role. Those concerns really do go down. They're not eliminated, but they go down. It's much more of a factor, much more risky, and probably worth getting some advice if you're picking and choosing based on value or performance to your organization. All right, reducing hours and or pay. Number one piece of advice here, or principle, is to always do it on a go-forward basis. Retroactive pay changes do not work and lead to wage and hour claims. So I've been asked recently, what's my minimum notice period? How much time do I have to give them before they suffer the pay cut? The answer there is not a popular one with your employees, but really you could do for your hourly employees as quickly as next day. Tell them that, hey, so sorry, as of tomorrow, we're gonna have this new wage for you. It can be that simple. But I want you to document that. If any of you have to make these decisions, a lot of you are running so fast and hard right now that I've caught a couple clients just orally making these announcements. That, in my experience, leads to claims down the road where someone didn't hear it, someone claims they didn't hear it, whatever it is. You want to make sure you've got something in writing to them, informing them about effective whatever future day going forward, you're going to have this new rate of pay. Where things get much more tricky is for salaried exempt workers. It's not rocket science. You can do it. You can lower exempt employee salaries during this crazy time. But there's some firm rules on this. I would urge anyone who's looking at this to get some advice and use those links I've given you. Short version is that we know to pay someone on a salaried exempt basis, which means we don't have to worry about overtime. We don't have to worry about break and certain other wage and hour rules. That's a great thing, but we've got to follow the rules. And if we wiggle their salary up and down based on quantity or quality of work, we've destroyed the salary basis. That's the general principle. You can't do it. But what you can do, there is an exception that I haven't had to use before in federal and state law that say if you're adjusting a new normal in response to an economic slowdown, you can make that salary change on a go forward basis. Can't dip below the federal minimum, that's $684 a week. But you can make these looking forward changes. Again, don't put an end date on it. Don't say, oh, for June when we know we're going to be really slow. You've got to make it the new normal going forward. Doesn't mean you couldn't restore them down the road when times are better, but anytime you start moving up and down month to month, you're going to ruin the salary basis and invite wage and hour claims or claims for unpaid overtime. Let's see. Watch out also for any of your reductions. Minimum wage and minimum salary basis links are at the bottom. All right. Most folks, I think, would agree that temporary layoffs or furloughs, the preferred for most employers, preferred to the permanent move of separation. You can temporarily lay someone off. You can furlough and still they can be qualified for unemployment insurance. They've suffered a work loss, they've suffered a reduction in hours, you name it, they can still go get benefits. So a lot of reasons that my clients are preferring this option where they can. Another advantage to you all as business owners is your ability to ramp back up more quickly, not having to go through your onboarding rigmarole with W-2s and whatnot. You're more ready to go if you're simply calling workers back. How long will it be? There's no rule here that says a temporary layoff has to be 6 days, 6 weeks, 6 months. You can set your time frame. I would encourage you to do that. Give people an idea of what you're expecting, get it to them in writing, and update them as you go if things are changing. Keep your normal payroll faucet on. If they've accrued wages, you cannot suspend wages during a layoff for any reason. If they're not working though, of course, you're not going to pay them for any time. Now, Bureau of Labor and Industries will take the position that if your layoff is likely to go over 35 days, you'd better follow the final check rules in Oregon, which are brutal. They say, get them that paycheck within 1 business day of giving them the news. So that applies to, say you want a 2-month layoff, you're going to want to get them every dime they're owed by the next business day. And frankly, best practice is to give it to them as you're delivering the news. Watch out for that, getting that trip up. Finally, 2 tougher topics about what happens when you put people on a temporary layoff. Let's talk about health insurance first. I just responded to a question that someone sent in on this. Can I continue to cover my employees' health insurance if they're on, say, a 2-month layoff? Answer, it depends on your plan. Some plans are allowing it. In fact, I've heard of plans that allow up to 4, 5, even 6 months if it's considered a temporary layoff, if you have an expectation of bringing them back. You're in a position to keep paying their health care without activating COBRA or a loss in coverage. That's awesome. Please do it. But you don't have to. The loss of hours in employment could trigger a cancellation of their health insurance plan. Then they can elect COBRA. We also have some clients that are trying to pay that COBRA cost for their employees, but again, you're not required to. Last but not least, do you let them access paid leave while you put them on a furlough? Ouch, the true answer is it depends, but you do not have to in most cases. So if you have for example, a vacation policy and they have accrued vacation, you could freeze it for the duration of your temporary layoff. Unpopular news, your employees will not like it or appreciate it. I should add too that you should check and make sure that that advice is compatible with your policy. The trickier issue gets to their Oregon sick leave. If they had to go home because of a public health emergency, you shut down because of that emergency, they probably have to access their sick leave, but there's other circumstances when you could even freeze their access to sick leave in this economic crisis. Get some advice if that is of interest. Last slide of your whirlwind overture of layoffs. For group terminations or more permanent layoff. Again, you're going to want to document the termination date, email or letter notice to them, and document the fact that you gave them their final check on time. So again, Have it in hand when you give them the news, if at all possible, but get it no later than the next business day. Get it in their hands or get it in their direct deposit. Got some link to more advice from Boley on that. For either group terminations or furloughs, larger employers should always consider a disparate impact analysis. A lot of folks are having hard making time for that here. What the heck am I talking about? That's when you look at the group of people that are impacted by your layoff decision and look to see if there's a disproportionate impact on, say, your older workers. There's ways to address that risk, but I'll tell you, it's mostly an issue for those of you who have, 20 plus employees. Could it look like you were singling out the older workers with your layoff decisions? It's something to watch out for. Larger employers, last couple points are for special circumstances only. Those with 100 or more employees might have a duty under the federal and state WARN Acts to give as much advance notice as possible to their employees and to send notice to local government and Dana over at WorkSource, right? I think there's a link included that'll get you to where you give your notifications to the rapid response teams if you're required because you're a larger employer doing a plant closing or mass layoff. Last but not least, anytime you're doing an employer of any size, a group severance program. That means I'm laying folks off, but I'm offering a goodie, whether it's a little extra health insurance or a little extra pay in exchange for a release. There are rules to follow to make sure that release is effective. Older Workers Benefit Protection Act, that's OPBA in the slide. You'll have to give certain disclosures about the titles and ages of employees who are impacted. You're gonna wanna get some advice if you're doing a group severance program. That's what I've got, Katie.
Great. Thanks so much, Kurt. That was a lot of great information. Hey, we got Juliana back on from Boys and Girls Club. We just have a quick minute. Juliana, do you want to finish up your thoughts? You're on.
Okay, perfect. So like I was saying, we made a really difficult decision, like many of you, to lay off 22 out of 24 staff. Really, we're weighing preserving the organization and taking care of our people. So we did do a severance. It's a temporary layoff. We're definitely planning on calling them back. We want to have those jobs for them to come back to. And so that was part of the strategy. I think what benefited us was acting early, taking the information that we had and working with our board and team and not comparing too much to what everyone is doing. I think you can get caught in that comparison trap. And then just taking care of people and communicating with them. So I'm sending weekly emails with updates on unemployment, mental health things, just different things to support the team. We're doing weekly Zoom socials, so we're staying connected even though we're not physically together, just to help us be ready to roll when it's time to start back up again. We're hoping for summer.
Great. Thanks, Juliana.
Yeah.
You could rejoin us. So I'm going to go quickly to a few questions. Kurt, this may be for you. It might be for Dana. If we apply for the WorkShare program, does that mean we need to start submitting lower hours for those names we submitted as soon as we get approval? And could we submit and then wait a few weeks before submitting hours? Does anybody have a take on that? Maybe.
I believe you have to be approved first before you can reduce your hours.
Okay. All righty. Next question, Brianna, I think this kind of goes to you. Thoughts on the possibility of lobbying. This speaks to reopening dentistry businesses and other healthcare businesses to, and restaurants. And Cheri, you may want to take this too. The possibility of lobbying to have staff wear masks as an alternative to staff social, I guess this is more restaurants, to social distancing in kitchens and the bar in the front of the house. They're saying that airlines might be doing this. In your workplace, Cheri, do you see this as a possibility?
Yeah, I think that's a real possibility. I think we're going to have to think way outside of the box from wherever we thought whatever we thought we would do. I mean, wearing masks in a restaurant does not seem like something I've ever entertained, but I think that is a real possibility. They're also talking about plexiglass structures between tables and things like that. I think that's a little more difficult to put in place. And I'm hoping that we have some data to make these choices off so that we can be doing the things that are most impactful to prevent the spread of disease, not the things that we think might prevent the spread of the disease. So I think we've really got to look towards science and research while we're trying to open things back up. I'm going to be advocating that we open back up our elective surgeries sooner than later, because I think that our doctors are capable of managing the spread of the virus, and we have patients that are needing gallbladder surgeries, and those are not what I consider elective. And so really starting in the science base, and I think doctors are probably the first most capable people to open back up, and then they can be starting to tell us things that we need to do in our restaurants.
Okay. Kurt, quickly, a question about how long an employee can stay off due, just to be, if they say, look, I'm afraid to come to work. What advice do you have for an employer who has an employee who's just said, look, I don't want to be exposed? What advice would you give that employer?
That's a good one, Katie. That's a tough one. Frankly, if they've exhausted all their paid leave rights, they've used their Oregon sick leave, they've used FFCRA leave if that was available. I think the best analogy I can give you would be that I'd likely want to treat this as a disability accommodation situation. I'm not saying that fear of COVID-19 is a disability, but I would take an analogous approach by working with them to try and accommodate the fear, and if necessary, building my case for why this is an undue hardship on the business and communicating about that. We need you. What if you did this? What if we put you over here? What if you work with them and try and accommodate it like a disability? Can't give you a bright line though on when that undue hardship standard is reached, but I think it's probably the best course to try and work with them to resolve it and ultimately pull the trigger when you think you're there. Yeah. Yeah. Okay. We are going to need to wrap up today's webinar. Any last minute thoughts any of you want to share in about 30 seconds?
Katie, can I just give a little unemployment update? The unemployment department hired 400 people, and they're hiring 400 more currently. We started this crisis out with 100 unemployment workers. We will end next week with 900 workers. So that'll help get through some of the claims. If your staff is reaching out to you, there's a few things you can do. If they have a denial, work through the denial, but if they have a claim number, just have them continue to process the claims weekly and make sure that you're getting the paperwork that's coming through. That means their claim is in process. If you as an employer are receiving the paperwork and they have a claim number, there's really nothing more to do than wait for them to get through the crisis of the just sheer amount of volume. And there's now going to be 900 people as of next week helping to do that. So I just want to give out that little tidbit. Yep. Thanks.
Thank you, Representative Helt, rather than restaurant owner Helt. I appreciate that. Thanks for the update. So we are going to close out. A couple of things as a reminder. We know this is hard. Hang in there. Tell us what we can do to help. We are working with the city again and the state. Be looking for some protocol coming out in the next 2 to 3 weeks from the state and from the city on what the restart looks like. And hopefully that's information that you folks can use to help prepare and understand and at least have some known universe that you can actually work with in your own businesses. Don't forget the sosbend.com website. Register there if you want to directly connect with your customers to provide cash flow in the interim. And finally, materials from today will be available again from Kurt's presentation and also Dana's, as well as other helpful information that we found that we think might be useful to you and your business. We want to thank every one of you for being on today. We want everyone to take care of yourselves and your families and your coworkers. And we're working on this together, and we wish you all a speedy re-entry back into what hopefully is going to be normal again someday. Take care, everybody. Thank you.